Hi guys, today I'm going to be doing a video on breastfeeding, and I just want to start off by saying I do believe that fed is best, so this is not a video to bash on formula feeding. This is a video that I got some inquiries about, and I do breastfeed. So I'm sorry, that's my baby is playing with some musical instruments out there. So I am about 10.5 months in so far with breastfeeding. And so this video is kind of going to be about like what I've learned through breastfeeding so far. And there's been a lot of ups and downs and ebbs and flows. So just know, just like raising a child, there's going to be some really hard times, some easier times. Your challenges are going to change. Just with any relationship, new challenges come up and then other ones kind of go away. And so what I'm going to do is I have top 12 tips or thoughts on first-time moms and breastfeeding in general. So I'm going to kind of go through those now. Okay, number 1, trust your body. Trust that your body can breastfeed. Trust that your body knows what to do. Trust that your body can support a child and support them with breast milk. You have to stay positive because some people just know. Before I even got pregnant, I was like, I'm gonna breastfeed and it's gonna work and it's just gonna do it and that's what we're gonna do. And that's what I did. And I'm not saying that's how it is for everybody, but you have to stay positive. If you're worried or constantly stressed out if you're gonna make enough milk, all you can do is try, and so you just have to stay positive. So your body was made to do this, and just know that you can do it. So many women can breastfeed, and I'm sure that you can too. Number 2, use the lactation consultant or the doula or the midwife, wherever you are, whether you're in a hospital or you're at home. That's what they're there for. So don't feel bad if you keep calling them back to the room, if you call them up at 3 in the morning. That's their job and that's what they're there to do. So take advantage of them, especially as a first-time mom. Even if you've had multiple pregnancies, sometimes it's nice to have a refresher course, especially if it's been a while, but use them. Have them come up, they'll show you different techniques, different positions, make sure your baby is latching correctly, and just give you that confidence that you need. And then when you go home, don't be afraid to follow up with them, because sometimes you're in the hospital or they're at your house and you feel like, oh, I got this, and then you go home and a week later you're like, why does this hurt so bad? Or they don't seem like they're latched on or they're getting enough. Call them, and a lot of insurances will cover 2 to 3 visits, or if they don't, it's definitely still worth calling. Sometimes they can just talk to you over the phone and you'll feel a lot better. Number 3, your milk won't always come in right away. So some people it takes a day, some people it takes 2, 3, sometimes even 5 days. So don't be freaked out if your milk isn't in right away. It will come in, and trust me, you'll know when it comes in. So at first, they're just going to be getting colostrum, and so some people start producing that towards the end of their pregnancy, and they might even leak that towards the end of their pregnancy. Some people don't, and that doesn't mean that you don't have it. You will have it once the baby comes out, and it might not seem like they're getting much, but they are. It's super nutritious for them, and just make sure you're always putting them to the breast so that they are able to get that in the first few days until your milk comes in. That's really all they need those first couple days. Number 4, engorgement. So that's a nice follow-up to number 3, just because it will happen, and when it does, you will know. You're gonna have, it's just a heavy, rock-hard, porn star boobs. It's an experience. You'll have it. I can't really explain it. You'll know when they come in, and that's when your milk comes in. And what you can do is, I took a lot of hot showers and kind of just massage the breast. There's going to be lumps, and you'll figure it out. But for a few days you're going to be really sore, but it will go away after a few days. Nurse as often as you can. That's my number 1 tip. Nurse as often as you can. That way they're kind of clearing out the milk ducts, and so you're not getting mastitis, which is a infection or kind of a blockage. So just make sure you're nursing often, and it will help relieve that pressure. That way they can create more milk, and then it's just kind of a system. They nurse and then more milk comes, and then they nurse and then more milk comes. It's exactly what you want. So nurse as often as you can, and after a few days they'll go away. I promise. It's interesting. Number 5, it can hurt. Especially at first, it's not strange for it to hurt a little bit. They're latching on constantly, and you've never had something latching on that often, and some babies have really strong suction, so you just have to just wait it out and use different like nipple creams, and you'll get through it. You just kind of have to get through a couple weeks, and if it's like excruciating, there's a different kind of pain between like poor latch and just getting used to nursing. It will go away, and then you won't even feel it really when they latch on. So it's okay if it hurts at first, and it shouldn't be like terrible pain, but I mean, it's just a different feeling. So it's not gonna be completely pain-free at first, but it will be fine. Number 6, they're gonna nurse a lot. And when I say a lot, I mean all the time. Not just every hour, sometimes it's all day. Every 10 minutes, every 20 minutes, every couple hours, they're gonna nurse a lot. And you might be surprised how often they wanna nurse, but what they're doing is they're building up your supply based on their needs. So it's a good thing. So keep offering it. Nurse on demand, which I mean, nursing on demand is kind of just nursing when they ask for it. So if they're crying or they want comfort, really when they're that small, they're just gonna nurse all the time. So just be prepared for that. I didn't realize how often they'd want to nurse all the time. So just get some Netflix going, get some Bravo going, whatever you gotta do. Set up shop, and it's going to be a couple weeks of nonstop nursing, and there's going to be growth spurts where they're nursing all the time, and that doesn't mean that you're not producing enough. It doesn't mean that what you have isn't good enough. You're not doing anything wrong. They just nurse a lot at first, and it's a really good thing. So you're not alone, and it will get better. Number 7, your baby is going to cry, and your baby's going to cry a lot. I did not realize how much your baby cries at first, and some babies don't. I don't know where they come from, but some babies cry a lot. Most babies cry a lot, and especially when your baby's establishing your supply, they're going to cry, and there's going to be a witching hour, which is kind of a couple hours depending on, it could be different. For my baby, it was from like 5 p.m. till 8 p.m. and he would just cry, and nothing I did helped. Bouncing on a yoga ball is the best I could get, and that still didn't always work, but they're going to cry, and you're not doing anything wrong. You're not the worst parent. Your supply is okay. They're going through a lot of changes, and they're just going to cry. So just be aware you're doing great. Keep offering them the breast whenever they want. If they'll only sleep or they'll only be content with a boob in their mouth, do it. What else do you have to do at that point? And it's great for both of you guys. It's really bonding. So just know that they're going to cry. There's not always a rhyme or reason. Your baby isn't starving. It will pass. Number 8, this is your nipple creams, your leaking pads or breast pads, your nursing tank tops, your nursing bras. I use this. This is actually still from when he was a baby, and he's over 10 months. So this is Earth Mama Angel Baby Natural Nipple Butter, I think it's called. And this is like an all-natural option. You would just put this on your nipple in between feedings, or like right before or right after, whatever. And they can nurse right after you put it on. And they can swallow it, and it's completely natural and fine. You can also use coconut oil, which is a cheaper alternative, but this they have at like Target, and it was great. Just kind of helped soothe any cracked or sore nipples, so this helped a lot. I would definitely recommend getting something, and of course natural is always better. So I also have these breast pads. These are bamboo, reusable, washable. You just throw them in the wash. I got a set of 12. And they're really soft. There's different sizes. I think I got them on Amazon. I'll try and link them in the description bar. But so this you can purchase, and you just put these in your bra or your tank top or whatever. And when you're nursing, on the other side, if you're leaking, which you will leak a lot, put these in there. I used disposable at first, but I was just going through so many of them, and they weren't super soft, and they were loud, and they were kind of a waste. So this is better for the environment, and you can just rewash them, and they've been great, so I recommend those. I do recommend getting some nursing tank tops. You don't have to get all fancy and get all like the fancy nursing clothes, but just a set of like nursing tanks from Target were great, where they just kind of clip down and it's just easy access. I lived in those, literally still live in those. And what else do I use? Nursing bras, maybe just like 2 of those, and just kind of like cycled through those in between like nursing tanks and nursing bras. And I mean, at this point, if you're not wearing a V-neck or a nursing tank, do you even nurse? Just kidding. But you pretty much have a restrictive clothing selection when you're nursing. So you can always do like a tank top and a shirt and like lift the shirt up, and then you have a tank top so you're not like exposing the world if you feel more comfortable. But you might just be naked at the beginning, and that's okay. So it's easy access, and do what you gotta do. So those are my recommendations. I didn't really use a nursing pillow. Some people do, some people swear by them. It just depends on your baby and your latch and the way that you hold them. I kind of just shoved a pillow up under one arm, and I did have, I think, 2 different kinds of nursing pillows, and I might have used them like once, but I didn't really need them. I don't know. We found a way to just make it work without. So you might not need one. So number 9, don't give up. The first like 3 to 8 weeks even are hard, and they're exhausting, and you feel like maybe you're not doing it right or you're not doing enough, but it will get better, and those times will pass, and then you'll kind of laugh that you were so nervous and anxiety ridden about it. It's hard, and so if you're in the thick of it right now, I swear it gets easier, and you're doing such a good job, and it's just hard. You'll get more confident each day that you do it, and I know I did. And so just know it's hard right now, and it gets easy after 2 months. So hang in there. Number 10, wait to pump. So people get different kinds of information on this topic, and personally for me, I would wait to pump. So a lot of people want to build up a freezer stash, and that's great. I mean, you should always have a backup if need be. My son never took a bottle, so I never really got to use it. But some people, if they're returning to work or they just want to give bottles, then they want to build up a stash, and that's great. But I would wait at least 8 weeks. That way your baby can kind of build up their supply based on their needs. If you're trying to pump in between your feeds, which are like all the time, you're going to get an oversupply, and that might seem like a good thing. Great, I have an oversupply, but it can lead to some issues. So you could get mastitis more often, and it's just not a great problem to have. Sometimes your letdown, which is when your milk first starts coming out to the baby's mouth, can be very, very strong and choke the baby. So you have to be careful with that too. But just wait to pump. After about 8 weeks or so, you could incorporate a pump if you're interested in that. You just want to establish a good supply with what the baby needs based on when they're hungry, rather than kind of a machine telling you when your boobs need to create more milk. So wait to pump, and your supply will balance out the way that it's supposed to. Number 11, drink all the water and eat all the food. You literally can't get enough water and enough food. I'm hungry even talking about it, and I'm thirsty even talking about it. So make sure you constantly are having food and water around you. My husband really helped, especially at first, like making me food, bringing me food. I kind of set up I had like a TV tray next to me, and I had like burp cloths, like the nipple butter, breast pads, food, like little snacks, water. I have chapstick, coconut oil, like all the things there, especially water. Like, you get so thirsty when you nurse. It's amazing how thirsty you are. So just have it ready there so you don't even have to worry about it, because sometimes you can't get up and you're going to be thirsty. So just kind of like set yourself up a station. It may take like a week or 2 to like fully know what you need and how often and blah, 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 but you'll figure it out. It's so nice to have just something there, and you won't have to worry about it. Number 12, it's hard. It's really hard, and it's emotionally and physically taxing, especially on the mom. You're kind of the sole provider for your baby, especially with your breastfeeding, and that's not to say dads can't help, but I just mean physically your body, it's exhausting, and it does get easier. And if you're in the thick of it right now, it does. I mean, you are, if you're going to continue breastfeeding, it's a big undertaking, and you're going to take on a lot of the brunt of the work, but it's worth it. And you can set up like a schedule with your husband. We kind of, especially early on, babies are pooping pretty much with every time they eat. So like, especially in the middle of the night, I would just kind of prep up, especially if you're sore and you're not really supposed to be getting up. Definitely rest, stay in bed as long as you can. But he would change the baby, whether he pooped before feeding or after. He would change the baby, make sure he's clean, put him back in his outfit, kind of rock him a little bit, especially if he was like in the middle of the night trying to keep him asleep. Then he would bring him to me, and he'd almost like turn him and like bring him to latch properly, which is really helpful, and like put a burp cloth on my shoulder, and then I would nurse him and then lay him down and try to get him to go back to sleep, or wherever you have the baby. But just kind of set up something that works for you, so you're getting any help that you can, and I'm sure your partner or your husband would love to help any way they can. So just kind of set up a little system that works for you guys, and that will be huge. But just know that it's hard, and I mean, anything worth having is not easy, so just keep at it. It will get better, and you can do it. 13, a little bonus, is keep positive people around you. I can't tell you how many times I've gotten critiques or judgment on breastfeeding, especially once you hit like 6 months or your baby gets teeth. Whatever happens, so maybe don't get teeth for a while, but for some reason people are weirded out by that and kind of make comments about it. Some don't, but keep those people that don't around you, or people that are going to be pro breastfeeding, people that have breastfed. You can join mom groups on like Facebook or breastfeeding groups, and just know you're not alone, because there's going to be times where it's so hard and you feel like you're doing something wrong, or I can't possibly be producing enough, or you just have a question, and you could reach out to those people and just know that there's other people that have gone through it and that it's normal. Because it's so easy to get discouraged, especially, you know, doctors can say just hurtful things, or maybe they're not gaining weight exactly how they should, but that doesn't mean you just give up. You know, you can reach out and get help. So just surround yourself with positive people, and people that are going to keep pushing you to breastfeed if they know that it's important to you. That's a good little bonus one. Those were kind of like bigger picture ideas and thoughts, and I could go more like into specifics and like a Q&A if people wanted to do that or they had questions. But I wish I had watched a video like this where it's just kind of like an overall, like, it's normal. It's normal if your baby spits up. There's a mom with a baby spitting up right now. It's normal your baby's crying nonstop for 3 hours. A baby does that. It's normal if your baby poops after every diaper. Like, these are things that I just wish I knew, so I knew it was normal. But it is normal, and someone out there is experiencing it right now. So I hope those ideas kind of help you and you just feel better and more confident about yourself. I know it's a lot to become a new mom and it's life-changing, but you're doing the best you can with breastfeeding, and just keep at it. If you want to reach out to me, I'm always available to talk. Again, my Instagram is Primal Heidi, or you can leave a comment here. I think my email is on my Instagram as well, but I'll put it down below. So I am 10.5 months into my breastfeeding journey, and I've learned so much. Obviously why I'm making this video, and I just want to encourage everyone to try. If you're even thinking about it, if you're watching this video, you're either an expectant mom, or you want to become pregnant at some point, or you're a first-time mom right now, 2 weeks in the trenches. I hope that this gives you some hope and some inspiration, and just try. That's really all you can do, and just do your best. I know there's situations, medical situations, and situational just like preferences where people don't want to breastfeed, and that's fine. That's totally fine. But for those who are interested, this video is for you. And okay, so that's it for this video. I hope that you learned something, moms to be or whoever. And if you have any questions, you can leave them down below. And happy breastfeeding.